It's a pet's life with Gym Dog, Ireland's first pet resort by Des the Vet. Managed by vets, loved by pets. Daycare, vet care, premium pet food and grooming. Visit at petslife.ie.
And for a Tuesday morning, a very good morning to you and a very good morning to our man Des Groom. Des, how are you?
Yeah, good, John. Good to be here again.
Yeah, it's good stuff as well. Hey, the weather's getting good.
It's picked up, it's improved, it's warmer. And I've had a few dogs coming in, and cats, by the way, yes, 2 cat cases yesterday with allergic dermatitis. So, boring old topic, but it's so common that we can't avoid it. So because the weather has picked up a little, all of a sudden the grass mites are out and about, and any dogs or cats who are a bit sensitive to parasites and inclined to get a bit itchy scratchy when the parasites are out there, lo and behold, the allergic dermatitis has started again already. That means I've seen a few cases of dogs and cats with itchy ears, itchy heads, itchy faces and itchy paws from being out and about on their travels and at play in long grass and in woodlands.
Okay, and sorry, is that where you put on the old spot on and away you go?
Yeah. Now, okay, so every dog should be getting the spot on now as we're nearly April. If they haven't had it for a few months, definitely they need the spot on treatment against parasites. And the ones that are particularly itchy, that have the sensitive skin, they might need to get a few antihistamines.
Okay. Now, we talked about that before. I'll come back to it in a second.
Yeah.
When it comes to spot on and other stuff that's equivalent to spot on, and I know that from just talking to you off air, and there's two or three different types that you can get. Explain the difference and why you give one instead of the other.
Yeah, so the cheaper ones and the easier ones that are available over the counter, they just have one chemical in them called fipronil, and Amflea is one of those, and Frontline is one of those. They just do fleas and harvest mites, so they're kind of limited, and you need to use them monthly. Then the stronger ones that are dearer are combination spot-ons. They do worms and ticks, as well as all the fleas and the harvest mites and the ear mites. Yeah, they're the strong ones. One every couple of months generally sufficient. They'll be dearer, they'll be around the €20 mark, but they do all the parasites. Are
the spot on and the spot on equivalents and the ones you're talking about, are they universal for cats and dogs? No, they're different. So the variety of chemicals that are in them are different. So for instance, the ones for cats contain a chemical called praziquantel for tapeworm, because tapeworm is more of a problem in cats than it is in dogs, whereas the ones in dogs, they're more ivomec based. They contain a chemical called usually milbamycin. So that's more for tapeworm and roundworm that dogs get. And there seems to be a lot going on regarding it. So you're saying at the moment that, you know, there's a lot of cats and dogs probably out there doing a bit of itchy scratchy at the moment. Is it just because of the change of the weather? Yeah, that's all. Ground temperature has increased a little. The grass is moist. The pollen in the grass is beginning to change. The grass mites they've sort of come alive again a little bit. And we'll see them in ears of cats and we'll see them in ears of dogs again, just because the last frost has passed, thankfully, over the last couple of weeks. Okay. What about when it comes to bedding and stuff like that, regarding ticks and stuff? Do they live in the bedding outside especially? They do. Fleas especially live in bedding. The life cycle of a flea is like the tip of an iceberg. The adult flea that you see on the animal is the tip of the iceberg, and 90% of the flea that's too small to be seen, the different other life stages of the flea egg and flea larvae, they're unseen, they're hidden, and they will be on bedding, and they'll be on grass as well. And are they just coming to kind of fruition now? Or are we seeing the trend with the likes of these fleas and mites? Is it because the weather has changed that they're becoming more active? Yeah, it's because the weather has changed, and like even in turf sheds and coal sheds, for instance, they'll be coming out of their cocoons. They'll be coming out of their larval form into adult form very soon. If not already, because of the slight increase in temperature. So turf sheds are a real location for fleas and mites, turf mites and grass mites and ear mites and so on, and mange mites. Okay. Now fleas, you could be unlucky and you might have fleas in your house. So something I would say, if you move house, say if you're a renter and you move from one rental property to another, if by any chance you heard that the previous tenants had a pet in the house, whether it was a dog or a cat, you'd be advised to do a really serious, very thorough industrial style clean to ensure that there are no parasites. Okay, that makes sense indoors. As well, yeah. So 90% of the flea life cycle is off the animal, so they'll be in bedding. Okay.
So that means now, for instance, it'll start happening from around summer. You'll have infestations on the animal and in the house. What we have to do in those cases are use these particular household sprays.
Okay. You said before that one of the great bits of bedding to use is old horse blankets. Why would you recommend that horse blankets as a good option?
Just the warmth and the heat of them, and they're so easy to clean and treat. And you can spray them. You can wash them good and strong, a 90-degree wash. So horse blankets and horse bedding is...
And they don't pull at them either. They're not going to rip them apart.
Harder to eat and harder to pull apart.
Yeah. Good advice.
So we use them in our kennels there, for instance, in Gym Dog as the dog's beddings, and got a donation of them from the Curragh Equestrian Laundry there in the spring, and they're the business. They're great for us.
Okay, very good. Another one I wanted to ask you about was Jenny was on. She says that her dog has come into a heat, and the problem is there preventative measures regarding coming into heat? Can you get injections, give them tablets, etc.? We just got caught this time round.
Yeah, there's an injection you give, is Stilbestrol. It's a type of a long-acting contraceptive for dogs, and you'd give the injection about twice a year, and that delays heat.
Okay.
So you can... For 3 to 4 times, you can delay heat indefinitely for a year or two in these bitches. But if you kept giving that drug, it can be damaging. It can cause cystic ovaries and things.
What about somebody what about a dog, so for example, that has already had a litter and then they go on it afterwards? Is that safe enough to do?
That'd be safe enough. A dog that's already had a litter and you were saying to yourself, oh, I might breed from her again in 2 years' time, that dog could get a couple of shots at 3-month and 6-month intervals of the Stilbestrol, and that would help in that regard in terms of delaying her cycle, delaying her coming back into heat. Now, this lady whose bitch is already in heat, now obviously that's too late.
Yeah.
So what she needs to do now is just really confine and be careful, and it could be 3 weeks that bitch might be at risk of being mated by a male dog, and just the nuisance of having male dogs bothering her when they're out for a walk, that could be a 3-week process.
Yeah, that makes sense as well. Okay, so I want to talk to you... Oh, hold on, there's another question after coming in here. Hold on a second. Oh, there's 2 more questions after coming in. First of all, what is the name of the expensive spot-on that can it be bought over the counter, says Mark, the one that you're talking about, the good one?
Well, for a dog... Yeah. So there's Prenocate actually, which isn't too expensive, 13 or 14 euros. There's a tablet form called Simparica Trio, is about 20 euros. And then the Stronghold and Stronghold Plus are good spot-ons for dogs. So Stronghold Plus, and that's about a 20 euro spot-on. He did ask about dogs. Did he ask about cats?
No, but you might as well tell us about cats as well.
Yeah, so cats, there's Broadline and there's NexGuard Spectra.
Okay.
That's like a spot-on in a syringe form.
Yeah.
You just put it on the back of the cat's neck and that
it soaks into the skin. It goes back into the urine. Is that the way it works?
It goes into the bloodstream, and then they gradually dispel or excrete tiny particles of it in their urine at a later date.
Right, okay, very good.
But it's soaked into the skin, yeah.
And that's the way it works. That's how it stops the...
That's how it stops. To have a kind of an antibody then at skin level, that if a parasite jumps on, it jumps on and bites, it'll be killed, it'll die.
What about when there's already a tick on an animal? What's the procedure there?
You could give a spot on when a tick is already on an animal, and within a day it'll have died.
Will it?
Yes.
It works that quickly, even though it's just putting it at the back of the neck, and away you go. So if
you have a big live tick on an animal and you're squeamish about taking the tick off yourself, and it's painful enough for the dog to remove the tick properly, so what you can do is you can get hold of a good spot on that has a good strong tick killing property in it. The Stronghold Plus would be an example of that. Prenocate is another, and you apply the spot on. Wait a day.
You mentioned earlier on that you put the spot on with cats on the back of the neck. Do you do the same with dogs?
Yeah, you do. That just stops them from licking it off, that's all.
Okay, right, because they can't get at it.
So if there's a big tick there, you put on the animal, you put the spot on and wait a day, and then that tick will be dead, and it'll be far easier to remove.
Right. And when you put it on the back of the neck of the animal, does the animal feel discomfort or anything? Does they feel it going through them or into their system?
No, occasionally you get the very odd cat that has sensitive skin, and there might be a slight little burn, a little inflammation or a little rash on the back of the cat's neck. And it's hard to know which cats are going to react like that and which cats aren't. It isn't really a problem. So that little bit of discomfort.
I know when we did it with our cat, not this time, but the last time we did it with our cat, he wouldn't talk to us for a few hours.
Yeah. So you can get the odd cat that does feel a bit of discomfort, and it's difficult to know which spot on is going to have
that
a reaction or not.
Okay. Right, here we go. Hi, guys. I have a large puppy. Can you run that by me again? She is 10 months old. How much of the spot would you give on, and how often? She is a giant schnauzer.
Yeah, no, just go into your vets and tell them it's for a giant schnauzer, and they'll know what weight your dog is, and they'll give you the appropriate dose.
Yes, because they do actually give the weights on the actual little syringy things.
All the doses, it's an individual single dose pipette that goes by weight.
Okay.
So you tell them in the vets and they'll give you the right one.
Okay, more questions coming in about this as well. Hi guys, I have 2 questions regarding, does this mean that tick and flea collars are now null and void? We're finished with?
Yeah, collars are null and void.
Forget about them.
They're a thing of the past.
They're not sufficient anymore.
No, not sufficient anyway, and they're not even really available anymore.
But the buzzword is spot on, isn't it?
Oh yeah, the buzzword is spot on. Now, even better, which lasts longer, you get these combination tablets. Now, a word about spot-ons, okay, and there's these controversy. I've had clients come into me and my advice is every 2 months.
Right.
There's a reason why they say, but it says on the box every month, and such another vet practice, they do it every month. Yeah, that's grand. It's about measuring risk.
Yeah.
So if you have a low-risk animal, I advocate doing it every 2 months.
Okay.
If you have a higher risk animal, say a hunting dog, or you have lots and lots of dogs, and there's more of a risk of them getting infected more often, then do it monthly. So the frequency that you give the treatment should be gauged by the risk of the dog getting the infection of the tick. I don't like over-treatment, because over time, with over-treatment, 2 things happen. Immunity builds up.
Yes.
And secondly, on a broader general environmental level, if we're treating all of these animals all the time, and collectively all of us are over-treating our animals, we will damage the environment.
Okay, well done. Ger was on. She says she has 2 cats, both of them 2 years old. They're always in great form, but suddenly lately both of them seem to have gone off their food a little bit. Should I bring the cats to a vet for a general checkup, or how often should you bring cats for checkups?
Well, once a year or so, but if they're off their food, that's serious. Cats shouldn't be off their food.
Right.
So, are they being fed by the neighbours? That might be the case.
Same when we discussed
so when you say off their food as well, sometimes when I'm asking questions about these things in the consultation room, I have to be like a little bit like a guard, and I have to, or a detective Columbo. I have to ask the same question in different ways in order to find out what's really happening. Okay, so how much is the cat eating? So if the cat has just become picky but is still eating a certain amount, then that would make me suspicious that they're being fed elsewhere.
Yeah.
But if they're completely off their food, then they're sick.
Yeah.
And that's serious.
Okay, Jim was on. He said, by the way, guys, just to let you know, yes, we removed our flea and tick collars off all our animals over the last 2 years or so and went straight to spot on. Huge difference, massive improvement. Yeah, good. The spot-ons are just going to be more effective. Yeah. Now, they're not going to be the answer. I suspect in a couple of years' time there'll be another solution, because they're all, believe it or not, there are already reports by environmental scientists of water contamination. Right. As a result of excessive treatments of animals with the spot-ons. Would you believe it? And these are a new enough product. They're only a few years in the veterinary sphere in terms of becoming so widespread. And the River Thames in London. Right. Now you can imagine, we'll say, what the population density of people and pets in London is. Well, they've done tests on the water quality in the River Thames, and they have found already minute qualities of the byproducts of animal spot-ons in the water. Wow. Well, I mean, that's a catch-22, really, isn't it? Yeah, it is. One, it means that people are looking after their animals, really, because if there's loads of spot-on being used, it's great for the animals, good health, I suppose, going forward too, but also the problems with the environment that it has. So if you're saying that they're going to look at it maybe a better way of doing it, what are they going to do? Are they going to put it in through foods and stuff? So there's a move in general in veterinary medicine to take on board a concept called One Health, whereby collectively, when we make rules and regulations about treating animals, we take into account what the human side effect or the human dynamic is going to be. So with regards to antibiotic usage, for instance, that means that we now use less and less antibiotics in animals, and we test for a particular disease or bacteria before we give the antibiotic. Yeah. So over time, what's going to start happening is we're going to implement services to provide testing for parasitism, testing for external parasites like fleas, testing for internal parasites like tapeworm. And we're going to be doing testing on these animals before we apply the products. Right. In order to ensure that we ration,
and underuse and use less of the product rather than overuse.
Okay, great stuff indeed. Right, now, here we go. I want to talk to you about food.
Yeah,
dog food and dog food trials.
Okay.
And tell us a little bit about this.
So you know that another specialty of mine is animal nutrition.
Yes.
And that in Jim Dog we have a nice successful brand of organic and natural hypoallergenic dog food. So the company we work with that manufactures our Jim Dog product for us, their scientists are working on a new product called Dental Care.
Yeah.
So I have brought out a version of the product on a trial basis.
Okay.
Jim Dog Dental Care, a dry dog food nut.
Okay.
And I'm running a clinical trial on the Jim Dog Dental Care food.
This is for dogs?
For dogs.
Okay.
And I need 50 subjects.
50 subjects?
So far I have 5 or 6 signed up. I'm going to feed 50 dogs for free for 3 months.
Okay.
And look at the overall health of the dogs on the product, what their body weight and muscle tone is like at the end of the 3 months, and more importantly, what their dental and oral health is like at the end of the 3 months.
What type of foodstuffs now are we talking about? The dog?
It's a crunchy dog nut in a heart-shaped kibble.
Yeah.
It's got an abrasive activated charcoal ingredient in it to help with the teeth cleaning and to get them to chew it plenty. Okay, and with this trial, now you're going to be in a catch-22 by trusting the owners kind of to stick with what you're giving them, and also stay away from other stuff, I presume. Or is that what your recommendation is? Yeah, I'll be hoping that they stay away from other stuff, and they feed just our Jim Dog Dental Care product for 3 months. And we give them a bag of it a week, and we look at how the dog is doing intermittently, and we take a picture of the dog's mouth and have a look at the dental hygiene and the gum hygiene during that 3 month period. Okay, so when are you going to start this trial? Well, we started already. We've signed up. We've 5 dogs already have begun the trial. Okay, so but you need a total of another 40 or 50 more. We do. We have to try and get another 40 or 50 more if we can. Okay, so how would they go about getting in touch with you guys? Just give us a call at Kildare Vet Surgery and make an appointment to come in. It's a free sign-up, a free quick little dental exam, and take away your Dental Care dry food product and stick with it and come back in intermittently to collect more of the dog food and to let us have a look at the dog's mouth. Are you specifically going any type of breed or style or weight or height or age of dog? We need a mix of old and young and large and small breeds. Male and female regardless? Yes. It doesn't matter? Yeah, I have retrievers signed up and I have a couple of little chihuahuas signed up and so on. So I need them from large dog to small dog. Okay, so if people want to get in touch, we'll give you that dual's details in a couple of moments again, just to wrap up on this. And don't forget, we'll be putting this up on podcast later on as well. You get the details there at the tail end of it too. Right, come back to that in just a second. Have a Jack Russell does not seem to be eating much food recently. Any ideas? Could be anything, but the first thing that springs to mind, what we're just talking about actually, is dental health. Dogs get a little bit slow on their food when they start to develop gum disease, tenderness and soreness in the mouth from either toothache or gum disease. Okay, and we have another one in from Des. Hi guys, my giant schnauzer is doing very well on that. You're on your dog food, it says here, says Des. The salmon, I presume it is. Good. Her teeth and black coat are absolutely fabulous, sticking to the diet religiously, I presume. Excellent, glad to hear it. Okay, well done. That's Des. Des, thanks for that. Bernie was on, yes, I've tried lots of dry kibble over the last number of years, and in recent times we kept our dogs away from the wet food except during the summer, but it works really, really well, dry kibble. Yeah, stay away from the wet food. Use the dry kibble for convenience and hygiene and cleanliness and everything else. It's a good solution for the modern pet and for modern living. Yeah, and to be honest with you, even from a cat's perspective, I know you're talking about dogs, but from a cat's perspective, our cat seems to be munching away at the nuts. Occasionally does get a few tidbits, but basically stays on the dry dog food that I think we got from you guys as well. Yeah, that's good. Again, if whenever a cat gets fussy and picky and starts being a bit slow to eat the dry food... Yeah. The only caveat I'll put to that, Des, is cats don't seem to never see to drink water, even though we're both right. Okay, but so when it comes to the warm weather, particularly as the temperature comes up, how do you get the right amount of I suppose keep the hydration into the cat? It's hard to get a cat to drink. They tend not to drink enough. The water fountains in the house are a great idea. And do observe your cat, and you might notice the cat drinking from a water source, a running water source outside. They prefer running water to water in a bowl. That's why they tend not to drink at home if they can avoid it. But look, if you think your cat has kidney problems or anything else like that, you can put some wet food into the dry.
Okay, on to Orla's out in Kilcock. She says, is it safe to actually still give your dogs milk? Or sorry, your cat's milk. Sorry, cat's milk.
Some cats are lactose intolerant.
Yeah.
And I don't know which ones are.
Right.
You can't tell.
But you wouldn't do it as their main dietary supplement?
No. I'll tell you what, I'll look it up now, and I'll find out what percentage of cats are lactose intolerant.
Right.
And what I would say to that listener is, you might get away with it, and you might not. Mm. It'll cause tummy ache, colic, diarrhoea if your cat is lactose intolerant.
Right. And to recap finally, so let's go back to what you're looking for. You're doing this food trial, right?
Yeah.
It's basically for dental hygiene and stuff like that?
Correct.
Okay, you're looking for 50 dogs. You got about 5. People want to contact you, go for it.
Yeah, give us a buzz at Kildare Vet Surgery, 521-507 Kildare Town, or you could email us. You'll find the email on petslife.ie.
Okay, but that one, there's that one, is it the same one? Oh, God, just as we're wrapped up, 2 more questions came in. I'll just take these quick 2 questions regarding that Jack Russell. I mean, Jack Russell does not eat much food. My Jack Russell is only 1.5, and he just won't eat food at the moment. He's just gone off it.
Bring him to the vet. That's not dental disease anyway. Some other little thing there. Might be nothing, could be just fussiness or pickiness. But the very first indicator of illness in any animal is a reduced appetite. Okay,
and separately to all of that, just one more final quick question because we're wrapped up. Could you ask Des, constipated stools, dry stools coming out? My Jack Russell is 10 years old, says Anne.
Yeah, fish oil in the food would help with constipation.
Okay.
You could get supplements like that in your local vets that'll help with that.
Okay, good stuff. On that note, we wrap it up. Don't forget, this goes up on podcast later on today or early tomorrow morning. And thanks for Des as always. And it's back again next Tuesday.
It's a Pet's Life with Gym Dog, Ireland's first pet resort by Des the Vet. Managed by vets, loved by pets. Daycare, vet care, premium pet food and grooming. Visit petslife.ie.